Okay, and then I will share my screen. Okay, so oops, and I want you to all disappear. How do I want that? And I want me. Okay, I'm hiding my thumbnail video. Okay, so I think we called this in the flyer, how to evaluate online health information. My presentation today is based on this tutorial from the Library of Medicine, and the official title, as you can see, is Evaluating Internet Health Information, a tutorial. And I've put the link in there, and I'll send the link to you later if you want it, if you want to look at it yourself and go through it yourself. It's freely available on the internet. For the grant, the National Library of Medicine and the National Institutes of Health wanted us to use their materials, which is really great as far as I'm concerned. And just a little thing that I know because I've been there, the National Institutes of Health is institutes plural, and there's lots of different institutes here, and it's in Maryland, and I've actually been there for a class last year. And the National Library of Medicine is actually one of the institutes on the campus. It's like this huge university campus, and the National Library of Medicine is actually a place there. So there's the little thing there about, we've got to tell you that this project has been funded with federal funds. So I'll keep on going into the tutorial. Yeah, so this tutorial will teach you how to evaluate health information found on the internet. And that didn't, oh, it didn't go. There's too many, here we go. Too many buttons, so okay. So using the internet to find health information is like going on a treasure hunt. You could find some real gems, but you could also end up in some strange and dangerous places. So how can you tell if a website is reliable? There are a few quick steps you can take to check out a website. And let's consider the clues to look for when you're checking out a website. And so the first clue is who runs the site and why have they created the site? And what do they want from you? So they might want something from you. And who is paying for the site? Does the site's information favor the sponsor? So is the information reviewed by experts? Where did the information come from? Does the site make unbelievable claims? Is the information up to date? Do they want your personal information? And if they want your personal information, what are they going to do with it? So I'll run through that really quickly. That's what I'm going to go over in the presentation as we go through. And what the National Institutes of Health has done is, and the National Library of Medicine has made this, they made this tutorial, as I said, and these websites are made up. They invented these web pages and set them up to look like real web pages. And they're really nice looking web pages. So we're going to compare these two web pages throughout this tutorial. So answering each of those questions that I just went through gives you clues about the quality of the information on the site. You can usually find the answers on the main page or the About Us page of a website. And site maps can also be useful. So we're going to go into how to get to these things. So let's say your doctor just told you you have high cholesterol. You want to learn more about it before your next doctor's appointment. And you have started with the internet. Let's say that you found these two websites. And as I said, they're not real. So anyone can put up a web page. I know some of you do make web pages for the library and stuff. So you want to find a trusted source first and find out who is running the website. So this is just how two websites can be arranged. And you said that, as I said, they're nice looking websites, aren't they? And so the first thing you want to look for, and I think I have my cursor. Oh yeah, there's a circle. Oh, the cursor brings up my slide thing. It had what I wanted to show you. Yeah, the About Us down there at the bottom left, down here. Oops. So the About Us page is a good place to start. So this is the Physicians Academy for Better Health, as you can see, and that's where the link is down there, About Us. So actually I might go and do that. And when you go into the About Us, look for a mission statement. And they say that their mission is to educate the public on disease prevention and healthy living. So that sounds pretty good. but it is a little vague, so we'll keep on going. And also look for information on the staff they have or the resources. And so in this example of the Physicians Academy, we've learned that this site is run by healthcare professionals, and it even gives their areas of expertise. And you can see there's a couple that are highlighted there, and you can read that really well, that say that they're a cardiologist. So they're heart experts. So that's what you were interested in. You were interested in information about the heart. So this is a good start. Okay. And one other thing, oops, let's see if I can move this. One other thing you're going to look for is, have they given you contact information? So look for things like email addresses, mailing addresses, and a phone number. And this one, it's right there at the bottom. Might be kind of hard to read. It says Physicians Academy for Better Health, 2309 Any Street, Anytown, USA, 555 USA. Yeah, so they just made up an address and phone number. But the information is there. Okay, so the locations and names of the about pages can vary. This one says about the site, which is a similar idea, but it's what you're looking for. And this is our Institute for a Healthier Heart. So far, they look pretty good. And then if you go into the about the site, it says the Institute for a Healthier Heart is run by a select group of individuals and businesses concerned with heart health. Okay, so that's a little different. A select group of individuals, it isn't a list of doctors with their actual real names and affiliations and degrees and stuff like the last one was, and businesses concerned about heart health. So who are the businesses? They're not telling us that. They're sort of giving half information. So the site sources really aren't specified. It's kind of a little vague. So it's really helpful to read this information. And they say our mission there is to provide the public with heart health information and offer related services. So it sounds good that they're offering information, which is what the last one was doing. And the related services, you think, well, what are these services? Are they free? Is there an unspoken purpose that they might be selling you something? But if you keep reading, down the bottom there, it says, the support of heart drugs, a company that produces high quality vitamins and medication. And I think I will read these out to you just in case you're looking at this on your phone when I think about it. It might be too small for you to read. But so they are being supported by a company named Heart Drugs. So that's kind of important information for you to know before you necessarily trust the information on this website. And where are the addresses and phone numbers on this site? And you can see down there, there's a contact us, but it brings up a little form that says, join the Institute now. And that's, you have to put in your name, email, zip code, and age, and you send it to them. That's how you contact them. They're not giving you phone numbers or addresses or even an email address if you wanted to email them. It's just a form. And these forms certainly have a use. The library website has one of these forms on it that you could just type in and it actually sends an email to the library. So they're not necessarily nefarious, these forms, but the library also provides our phone numbers and our address and all that other information. So that's just one way for people to contact us. But this is the only way you can contact them. So you don't know where the company is actually located. It could be anywhere in the world because websites can be up anywhere in the world. Okay, and then the important thing you notice is they actually want you to buy something. Because there's a link up in the top right corner with a little shop that says shop, and there's a little picture of a shopping cart, which most of us are probably very familiar with, the little shopping carts when we're buying something online. And So visitors here can purchase things. So a site's main purpose may be to sell you something and not just offer information, which they haven't really told us yet, but there are clues here. Yeah, the site isn't yet telling us directly, yeah, come and shop. It doesn't say online store, it says Institute for a Healthier Heart, doesn't it? Okay. And then when you go into the shopping cart, you find out that they are selling their own products. And I don't know if you can see that very well, but they strike me as awfully expensive, but they're made up products. So the vitamins are $35, the cookbook is $25, and a journal to keep track of appointments, medical appointments, is $25. So I think they probably chose those prices at the National Library of Medicine to show that they're kind of expensive. So they're just showing things, drugs from the company that is funding it. Remember, Heart Drugs Vitamins was the company they mentioned About Us that was funding it. So they might have lots of things that aren't from the Heart Drugs company. I mean, it might genuinely be they have other things on the site, but they might be favouring and pushing to the top the things from Heart Drugs because Heart Drugs is sponsoring them. Okay, so there's one to look for. And another thing to look for to see if there are ads on the site. And if there are ads, can you tell them from the health information? And both of these sites actually have ads. On the Physicians Academy page, the ad there down at the bottom left is clearly labeled as an advertisement. It has the big word advertisement in it. And I'm not sure if you're all aware that Google searches also bring up ads, because I met someone who I thought would know this, that the first two results on a Google search are often ads, and they're required by law to put to label them, but it usually has the two letters AD spelling ad in teensy tiny letter. But this one is quite clearly labeled. I think the advertisement is quite big. So it's easy to tell apart from the content of the page. Again, you have to kind of be paying attention. You might not notice it at first, but it's there, the information. And on the Institute for a Healthier Heart page, it's actually hard to tell the difference between the ad and the content, because if you might not be able to read it really well, but the latest heart news, and they've got treating sleep apnea and low-level jobs linked with faster variable heart rates and about social connections, all things that are well known to help your heart health. And then at the bottom it says, learn how a revolutionary new drug can help your heart. And that is an ad for the heart drugs. So the ad is not labeled, but it's there. So, and so another thing to look for is for the quality of the information. And sometimes they have a clearly stated policy for their quality and their priority. So you should be looking for that, a policy about what they're going to actually put on their website. And yeah, I'll read the editorial policy out for Physicians Academy. It says, delivering cutting-edge, reliable information is our top priority, which again is a little vague. Our board of directors reviews the material that we disseminate on the site. We're committed to providing accurate, unbiased information. We regularly review the material on our site to ensure that it is current. We will not accept advertising that conflicts with our mission. Any advertising on our site will be labelled so that it is separated from our medical content. And it sounds pretty good. So since they have an editorial board, a selection policy, a review process, that can point you in the right direction. So let's see if these clues are on both of these. So we'll go back to, yeah, and remember the people that are doing this are all doctors from there, or there's physical therapists, but they're all health professionals. So it's got a very clearly stated policy. And then you go to the Institute for a Healthier Heart, and it says the Institute for a Healthier Heart is run by a select group of individuals and businesses concerned with heart health. Remember, we saw that before. But you don't know who these individuals are. They might be doctors, or they might be researchers, pharmacists, because they are selling heart drugs. So they might be pharmacists or medical researchers, but they're not telling us that. We don't know. Okay, and then again, we're going back that the site is getting support from that drug company. So it's possible that this group writes the information for the website in order to promote the company. And so even if experts review the information that is posted on the site, you should continue to ask questions. Look for hints about where the information comes from. Good sites should rely on medical research, not opinion. And it should be clear who wrote the content. Then check to see if the original sources of data and research are listed. And on the Physicians Academy site, they're telling you about, it doesn't actually say, something about genetics. This article you're looking at is about genetics, and it gives you the source. It says the American Journal of Clinical Nutrition. And this, even because it's blue, the American Journal of Clinical Nutrition, it's usually a link. So you'll be able to click on it and look at the actual article. And then and the articles themselves are very hard to read, but you can see if their numbers are right, or you can ask someone who might understand the numbers a bit better to look at them for you. And it says, it even gives the source down there where they found it. So, and the information here about cholesterol on Institute for a Healthier Heart also gives some references, but it's a vague reference to a recent research study. It says a recent research study found that genetics also plays a significant role in cholesterol. So, but if there is a recent research study that they are quoting or taking information from, they should really tell you what the recent research study is, and they haven't even attempted to do that. Even if they can't put a link in, because some actual research studies aren't freely available, you have to pay to actually read them, but usually you can at least put in the title and the authors and the citation and all that information, and then an interested person can actually try and find that article. There are ways of finding it, which I'll be going over in the next medical class, how to find it, that sort of thing. Okay, and then we're still looking at the quality of information. And one thing you need to look at with quality of the information is look at the general tone of the information. Is it too emotional? Does it sound too good to be true? And that can certainly be true of some of the medical sites that are trying to sell you something. They'll say this drug will cure cancer and acne and everything that could possibly ever go wrong. And so if that's too good to be true, so you should be a bit skeptical of that. Neither of the sites do have information that's overly emotional or claims that are too good to be true that we have seen. So the next thing you have to check is the information current? And because out-of-date information can be hazardous to your health as well. So it may not reflect the latest research or treatments. So look for some sign that the site was reviewed and updated regularly. So here's an important clue. The information on this site was reviewed recently. And down in the bottom left there, it says last reviewed, well actually it says the 15th of January 2017. And this tutorial was made a few years ago, so that was up to date for that time. So which is something you've got to keep going back and changing it to make sure it's updated. And then we go to the Institute for a Healthier Heart. And so there's no dates on here. the only date that you can see is their little quote at the top there, helping families live healthier lives since 2015. So you really assume that the web page was put up here in 2015, but you don't know how often they have updated it since then, because they're not telling you. That's just when the organization was formed. And then another big thing you should be looking at is the privacy of the site. Are they asking you for information? And of course, you can look at a website and generally not give them any information, but sometimes they take information. If you're in the public library, it's probably fine on a public computer, but if you're on your own computer, they might get information about you. So it says down on the bottom there, next to the About Us on this one, there's a privacy policy. So that's good. It's right there, so you can find it. So you click on privacy policy and see what it says. If you have to read some of these things, which aren't the most exciting things, so necessarily. So on this site, users can sign up for an email newsletter, and that requires you to share your name and email address. Obviously, you can't get an email newsletter if you don't share your email address. And the privacy policy explains how this information will be used. They say it will not be shared with outside organizations. And to only sign up for newsletters if you are comfortable with how the information will be used. And what they say they'll do, it says, if you choose to provide us with personal information by sending an email or subscribing to our newsletter, we do not give, share, sell, or transfer any personal information to a third party unless required by law. So they're saying they're not going to sell your information or anything like that. And then we find that the Institute for a Healthier Heart also has a privacy policy, which is pretty easy to find. Again, it's at the bottom next to about this site. And so we'll go in and we'll look at their privacy policy. And they freely admit, which I think they probably have to legally, that they are collecting your information, because it says, while you browse this site, we will collect certain information about you. This information includes which internet browser you are using, your IP address, and the URL of the website you visited before coming to the Institute's website. So they can do that without you knowing. That's just looking at the website. We also may use cookies that are erased once you exit your browser. We may use this information to improve our site and to enhance the regular operations of the Institute. Yeah, so they're going to be checking where people click and where people look, and change, and hopefully for them, change it so more people look and more people click. Okay, and then you look at what happens if you give them your email address. So it does promote a membership option, and you can sign up and join the Institute and receive special offers. And there's also a store on this site as well. And obviously you can't buy anything online without giving them all sorts of personal information, like your credit card number and your address. Otherwise you can't get the products. So it's very important to know what they're doing with this information. And so if you just join without buying something, they're requiring your name and your email, which you're pretty much required to be able to get an email, but also your zip code and your age. And you don't have to give your zip code and your age to be able to get an email from someone. Get on someone's email list. I don't know if any of you have signed up for an email in a store to get their promotions. Probably most of us have at some point. They're not usually asking for your age. So, and then you go back and check more about the privacy policy, and they're saying the information that they get from you, this information may be shared with the sponsors of this website, with the members of the drug company, or with carefully screened third parties as necessary for the operation of the Institute for a Healthier Heart. So they could be sharing it with basically anyone. So it's really good to read this before you put your information, you know, your email and your age and all that in, so you know what's happening to your information. And so I've gone over the nitty-gritty of the presentation, and we'll do the conclusions. So we've got, so the internet provides you with immediate access to health information, but you need to distinguish the good sites from the bad. So let's review the clues to quality by looking at our two fictional websites. So this site, the one for the Physicians Academy for Better Health, so it's run by experts. Remember, there were all those doctors and other health professionals, and it's got a clearly stated purpose, and it labels its advertising, and it reviews the information before posting it, and it explains the sources of the data and research, so, and gives you links to them so you can actually go and look at it yourself if you want to. And it's up to date, and it won't share your personal information. So okay, and the conclusions for the second website, the Institute for a Healthier Heart. And it doesn't really explain who is running it. It says it's sponsored by the heart drugs, but it doesn't really say. And so it may favor that sponsor, the heart drug company. And it's got an unclear purpose, and it doesn't label its advertising. It does not describe how information is added to it or where they're getting it from, and doesn't clearly identify the source of information, and it doesn't tell you how old the information is. It's not telling you when it's been updated. And if you do put some personal information in, and even if you don't, if you're just browsing on it, it may share your personal information with others. So take the time to check things out. We compared two examples of websites in this tutorial, and the Physicians Academy for a Better Health site, the blue one, is much more likely to be a reliable source of information. And that's the end of most of the presentation. And so look for all these clues as you search online. Your health could depend on it, because you might buy that heart drugs, and if it's just something they're selling, and possibly even from another country or something, it might actually be harmful. And when I share the link from this tutorial from the National Library of Medicine at the end, and I'll send you all an email and do it, you can look at it yourself, and there's a checklist of questions to ask when you're looking at the at health information. And we will be repeating this in the library, and I'll print it and bring it along when I have it then, but it's kind of hard when we're doing it on Zoom. Yeah, so each question that you ask will lead you to clues about the quality of the information on the site, and you'll usually find the answers in the home page in the About Us area. And asking these questions will help you find quality websites, but there's no guarantee that the information is perfect. So yeah, review several high quality websites to see if similar information appears there. And this is from the National Library of Medicine, and what they produce is PubMed, which is an aggregation. I think it was 28 million last time I was looking, different citations for actual scientific research and biomedical research. So you can look at PubMed, but it's very difficult to read. It's actual research, actual lab reports. But what they recommend is Medline Plus, and I'll show you how to get to that, and I'll send you the link to that. And I didn't open it beforehand. Let me go here. Oh, and this thing, I said, is having several things open at once puts them all in each other's way. And what I'll put in the chat is a survey, and I'll talk about that in a minute. I'll stop recording. Actually, I could just stop recording now, because I think, how do I stop? Stop video. I hope I was recording. Where's it gone? I'll go back here. Meeting control. Oh, I'll go back to here. Okay, so I'll stop sharing. There should be a way to stop sharing. Or share. Okay, I'll stop share. There we are. Okay, so I'm back, and I will send you. I'll share again in a moment. I want to stop recording actually because I think I'm done with the recording. And yeah, we're asking people to do a short survey because the National Library of Medicine wants that from us, and I'll send you the link to it, and hopefully it will work for everybody. I don't want. I've got a Zoom meeting sitting at the bottom there in the way. I can't. Having technical difficulties here. So you can unmute yourselves. Well, actually, no. Did I stop? Did I stop recording? No, I didn't. There we are. Found the recording button. Do you want to stop cloud recording? Yes.